So what if your body had its own signal booster? A way to turn up the volume on vital messages right when the communication lines are starting to fail. Well, today, we're diving into a medication that does exactly that.
Just imagine this for a second. Your brain sends a perfectly clear command, something simple like lift your arm. But by the time that signal gets all the way down to the muscle, it's just a whisper. It's all static. The message gets lost, and the muscle, well, it barely moves. For some people, this is a daily reality. It's a very specific, very frustrating kind of communication breakdown.
So what happens when that crucial link between a nerve and a muscle just stops working? The fallout can affect everything. I mean, everything from your vision to your ability to swallow or even just to smile. And this brings us right to a condition called myasthenia gravis.
Yeah, we're talking about myasthenia gravis. It's a chronic autoimmune disorder, which basically means the body's own defense system gets confused and starts attacking the connection points between nerves and muscles. It's a classic case of friendly fire.
And the symptoms are really specific. You see things like drooping eyelids, double vision, trouble swallowing, even slurred speech. These aren't just random, Each one is a direct result of that specific nerve-to-muscle signal failing to connect.
Okay, so to really wrap our heads around the problem, we first have to look at how this whole communication system is supposed to work. We've got to visit what's called the neuromuscular junction.
Think of it like a super-fast, three-step conversation. First, the nerve sends the message by releasing a chemical messenger. It's called acetylcholine, or just ACH for short. Second, that ACH zips across a tiny gap and plugs into receptors on the muscle, which is the signal to contract. And third, right away, a cleanup crew, an enzyme called acetylcholinesterase, comes in and sweeps away any leftover ACH. This lets the muscle relax and get ready for the very next signal. It all happens in a flash.
And right here, this is the core of the problem. In a healthy person, you've got tons of receptors, so the message gets through loud and clear every time. But in myasthenia gravis, the immune system has wiped most of them out. So the nerve is still shouting the same message, but with way fewer places for that message to land, the signal gets weak, it gets garbled, or sometimes it's just missed altogether.
So if you can't add more receptors, what on earth can you do? Well, you boost the signal that's already there. And this is where our protagonist, Pyridostigmine, finally enters the story.
Okay, the super technical term for it is a reversible acetylcholinesterase inhibitor. But let's just forget that for a second and stick with our metaphor. Pyridostigmine's whole job is to temporarily run interference on that cleanup crew. It basically keeps that enzyme busy so it can't do its job quite so fast.
So here's how it plays out. The nerve sends its message, just like normal. But now pyridostigmine is distracting the cleanup crew. This gives our messenger, the ACH, a lot more time to hang out in that gap, which dramatically increases its chances of finding one of the few working receptors that are left. The signal gets through, and just like that, muscle strength improves. It's a really clever workaround. Now let's be really clear on this, because it's a crucial point. Pyridostigmine is not fixing the underlying autoimmune attack. It's not building new receptors. It's what we call a symptomatic treatment. It's a brilliant strategy that just makes the damaged system work as efficiently as it possibly can.
But this signal-boosting trick is so useful that its story doesn't end there. It's actually been adapted for some other pretty high-stakes jobs that have nothing to do with myasthenia gravis.
Anesthesiologists use it all the time to reverse the effects of muscle relaxants after surgery, helping patients to start breathing on their own again. And this one is fascinating. The military actually uses it as a pre-treatment to protect soldiers from the deadly effects of certain nerve agents like sarin. In every case, it's all about managing that vital nerve-to-muscle communication.
But using this drug is anything but simple. It is a really delicate, highly personal balancing act of dosing and timing.
See, this is a very short-acting drug. It kicks in after about half an hour. It hits its peak strength in maybe 1 to 2 hours, and then it's pretty much gone within 3 to 4 hours. And that's exactly why patients often have to take it multiple times, all throughout the day, just to maintain a steady level of strength.
This means the dosing is totally individualized. It's not one size fits all. Patients become these incredible experts on their own bodies, learning exactly when to time a dose, maybe 30 minutes before a meal to help with swallowing, or right before an activity to keep from getting exhausted.
Okay, but here's the catch. Remember how the drug works by boosting that ACH signal? Well, that signal doesn't only talk to your arm and leg muscles. It works all over the body. So, the side effects are a direct extension of its main job. You get increased gut activity, which can mean cramps, you get more secretions like sweat and saliva, and you can even get a slower heart rate. The drug is just doing its job, a little too well, and in way too many places.
And this all brings us to one single critical number, 2, because there are 2 different states that can look dangerously alike.
This is probably the ultimate clinical challenge. You have what's called a myasthenic crisis, which happens when a patient has too little of the drug's effect and their disease gets worse. Then you have a cholinergic crisis, which is an overdose from too much of the drug. And here's the absolutely terrifying part. Both of them can show up with the exact same life-threatening symptom, severe muscle weakness. Telling them apart is absolutely critical.
And that really gets to the very heart of this drug. It's a true pharmacological paradox.
There's a great quote that says it's a classic example of a drug whose therapeutic effects and side effects are 2 sides of the same pharmacological coin. The very thing that helps is the very same thing that can cause harm.
So, if you remember one thing from all of this, let it be this. Pyridostigmine's greatest strength, that amazing ability to amplify nerve signals, is also the direct source of all its major side effects and risks. It's an incredibly powerful tool, but one that demands a huge amount of respect and very, very careful handling.
And that kind of leaves us with a final big question to chew on. How do you balance a treatment when its solution and its side effects spring from the exact same action? It's a central challenge, not just for this one drug, but really for a huge part of modern medicine. Thanks for joining me today.